the eyes are brought about by 6 extraocular eye muscles that work synergistically to provide conjugate eye movement. When paralysis of these muscles occur, it can be demonstrated when the patient attempts to move the eye in the direction associated with the action of that muscle. The function of the eye muscles and their nerves can be tested by having a patient track an object such as a finger or a pen while keeping their head still. The patient is asked to track the object starting from the midline in a pattern that resembles a capital H. First, they will be asked to track the object laterally, then superiorly, inferiorly, and then again in a medial direction, and superiorly and inferiorly. This will isolate the movement of the muscles to only test for the action of one muscle at a time. So clinical testing is a bit more complex to understand, because when I explained the actions produced by these muscles, it was explained as individual muscles producing individual actions. But the eye never it's never just one muscle moving at once. It's a coordinated action of these muscles at the same time acting as synergists or agonists and antagonists to produce a specific movement. So when it comes to clinical testing, it's first necessary to isolate a specific movement to ensure that the testing is only focused on one muscle. So just to first explain that synergistic actions, let's do superior oblique and inferior rectus. Both of these muscles depresses the eye. So superior oblique will depress and abduct, and inferior rectus will depress the eye. But also remember, the inferior rectus together with the superior rectus, by approaching the eye at that angle, will also adduct the eye. So the synergistic action for superior oblique and inferior rectus is to both depress. The opposite, the antagonistic actions, is that superior oblique will abduct and inferior rectus will adduct, right? Similarly, for inferior oblique and superior rectus, both of them will elevate, but inferior oblique will elevate and abduct, whereas superior rectus, because of that angle, will also adduct as a secondary action. So synergistic action for these two is to elevate, but antagonistic action, inferior oblique, elevate and abduct, whereas superior rectus, that angle, also adduct, right? Now to test, to isolate these movements, to clinically test for specific muscles. Clinician will, for example, first ask a patient to follow the finger laterally so that the eye is abducted, produced by lateral rectus. Okay, so that will test for the abducent nerve, which is the cranial nerve that supplies the muscle that abducts the eye. So when the eye is already in an abducted position, what happens for the rectus muscles? Now, instead of reaching the eye at that angle, when the eye is already abducted, their plane of action is now from straight behind the eye. So now it cancels out their ability to also adduct the eye, because now they come from straight behind the eye, an already abducted eye. So in this already abducted eye, your superior rectus will now solely be responsible for elevation, and inferior rectus will solely be responsible for depression. Okay, so to test for superior rectus, an already abducted eye, then elevation, superior rectus, or inferior rectus, then depression. Now similarly for the obliques, an eye that is already directed medially, so medial rectus moving, following a finger in a medial direction, adducting the eye. Now in this position, that angle that the oblique muscles attach on the eye is now on a straight line. So now in this case, For your obliques, it again isolate all that other movements that they can perform. It removes their ability to perform that. So for an eye that is already medially projected, already adducted, okay, now your superior oblique will purely depress. Remember, pulling on the posterior half of the eyeball, but the anterior part move in the opposite direction. So when it's already adducted, superior oblique purely depresses, or inferior oblique will now purely elevate. So isolating those movements, okay, already adducted, now you can test purely for superior oblique or inferior oblique. And remember, superior oblique is supplied by the trochlear nerve, so the muscle that hooks around the trochlea, supplied by trochlear nerve, and everything else supplied by oculomotor nerve.
This video was partially sponsored by Dirisana Plus, an EU-funded project.